We should go to the bathroom just cause. That's not correct.
Let's talk a little bit about overactive bladder. What is overactive bladder?
Yeah, so overactive bladder is the other kind of urinary incontinence. So it's a collection of syndrome, right? Or it's a collection of symptoms, sorry. So there's four things that I talk to patients about. Urinary urgency, feeling like you cannot control the urine when you have to go. Urinary frequency, going more than often. So normal voiding is about 7 times while you're awake, maybe once at night. But if you're going 10 times, 15 times, or every few hours, that's not normal. Nocturia, which is the nighttime urination, and any kind of leakage associated with that urgency where you can't control your urine when you have the urge. So all those symptoms combined or any combination of them is known as overactive bladder.
And what can you do to help prevent overactive bladder or treat it?
So just like stress incontinence, there are both conservative measures as well as lifestyle changes. And of course, there are some procedures that we do as well. But let's start with simple things first, right? Hydration, you mentioned, avoiding things that can trigger your bladder to have that urinary urgency. Some obvious triggers are bladder irritants such as caffeine, soda. Sometimes it could be alcohol. For some people, it could be something like dark chocolate, believe it or not. So avoiding those can help. Hydration, of course, I don't want people to be dehydrated, but again, know what's normal volume of water versus not. Bladder training, we should go to the bathroom just cause. That's not correct. You should still be able to hold your urine for 3 to 4 hours. So just because you feel like going and you run to the bathroom, that's not good. So kind of retraining your bladder to hold more, something we call bladder training, can be helpful as well. There are medications that we can prescribe to patients if needed, and then well as some procedures. For example, Botox, we can inject into the bladder to help relax the bladder muscles so they're not spasming, as well as a procedure called sacral neuromodulation, which is kind of like a pacemaker that you can place, which essentially regulates the signaling that's happening between the brain and the bladder.
Yes, I love that. And I would add that when I tell people about how much to drink, I think it's really like confusing, right? People are like, drink until you drink a gallon a day to lose weight, or don't drink, if you're peeing too much, don't drink too much. Yeah. I tell people, look at the color of your urine, right?
Absolutely.
If it's
That's a great
lemonade
point.
Yellow, it's good.
Yes.
If it's darker than that, you need to drink more. If it's lighter than that, it's
Yes.
probably okay, but you don't want to over drink, especially if you're already dealing with overactive bladder symptoms.
Especially in today's day and age, we're all about, holding on to our Stanley cups, which is great. Hydration is good. But again, to your point, if your urine is like crystal clear, maybe you can cut down a little bit.
Yeah. And I would add to avoid constipation.
Yes.
Yes, because
point.
that's a big contributor. People often forget that the rectum is right behind the bladder. And so when it gets full with stool, it's going to push on the bladder and make it more overactive.
Yeah. Some other thing I will kind of point out too, sometimes some of the same symptoms that are pathological can also cause similar symptoms as overactive bladder. So making sure you don't have an infection, right? A UTI can also cause that urgency frequency. Making sure your diabetes, your overall health, there's no other issues that could be causing some of those symptoms. So being on top of your health and kind of having a good primary care doctor who does some of those, primary health care maintenance can also be helpful.
Yes. And if you have any blood in the urine, make sure you see your doctor. I have found bladder cancer in patients who've had overactive bladder before, and they've been dealing with their symptoms for a long time. Turns out they have a tumor in their bladder. I don't want to make anyone scared, but if you see blood in the urine, don't ignore it.
Yeah, absolutely. Because those are triggers. Those are not good things to avoid.
Absolutely. Well, thank you so much. Where can people find you?
Yeah, absolutely. So, I'm very active on social media. I do have a YouTube channel. It's my name, Dr. Nabila Noor. I'm also posting, educational contents on Instagram, on Facebook, on TikTok. So yes, please follow me. And of course, my website is www.drnabilanoor.com.